Good morning. This is Dr. Mike, and welcome to our Wednesday session. Again, I'm sorry that I'm not able to be with you this week. I am in the middle of an intensive class for my PhD, which is I assume will be going quite well at this time since I'm doing this tape early. But most of these classes are quite a test of people. We're given papers and different things of the week, so it's quite intense. I need to have two 25-page papers done and then present a book during the week. So it has taken quite a bit of time to get ready for that, and quite a lot of late nights. And so I'm sure that you can understand that I have some of the same things that you face when you're trying to get ready to meet a deadline to get ready for class. But good to see you here. Don't forget this morning, after you've listened to this tape, that you send me an email letting me know that you have finished, so I can give the attendance to Cleveland. And then I'm going to try to have a live chat each evening at 7 o'clock. I'll send you the link at 6:30. If you can join that for a few minutes, it'd be great for you to check in. Let me know how you're doing. Let me know what I can do to help you move forward. Appreciate so much your understanding with this, and we're all students together. We kind of work on this together, and I appreciate your great help. Yesterday we began talking about we talked about virtue ethics and about the different virtues that we could hope to have in our lives, that we learn from other people, that we assimilate, mainly from parents and from grandparents sometimes. Sometimes you do it at school. If you don't have very good role models at home, there are role models you get from other places. And so I think there are a lot of virtues that would be very, very helpful to us to think about and to assimilate. There is a chapter number 7, or chapter number 8, I'm sorry, that I would, or 9, I'm sorry, I would encourage you to read on feminine thought and upon the idea of the ethics of femininity. We've talked about before the fact that women don't make the same money as men for the same education and the same experience. Normally, women make less money than men, and that is an ethical consideration that we should be uh, uh, busy working toward fixing. I think I told you about the Equal Rights Amendment that almost passed in the 1960s and 70s, in which both houses of Congress voted for it and the president signed it. And it had to go to the states for 2/3 majority vote. And a lady, Christian lady, by the name of Phyllis Schlafly with Eagle Forum, literally defeated that bill hands down by going state to state and campaigning against it and scaring people that this is going to be bad and that women are going to be drafted into the military and that they're not going to want to be the homemaker and the wife at home and everything that women had always been up to that point. And she literally defeated the bill. It has never passed since, and has never been brought up to my knowledge. I'm sure it's probably been tried again, but never successful. So I encourage you to read that. But there's a lot more to ethics as far as feminine issues. Genital mutilation in Africa, in places where that's done, used in Muslim countries where women are scarred permanently and they're little more than slaves. We've talked about, I think, Saudi Arabia with the women forced to wear the burqa in public so they can't show any skin. Look out through the little slit in their headpiece, and they have to be escorted by a male member of their family in public because her virtue has to be guarded at all costs. And so it's quite an interesting thing. Women have protested by the use of driving cars and things, which is against the law in places like Saudi Arabia, in public to protest their husband's ownership of them and those kinds of things. Christian fundamentalism, which is still around and still very much you hear the voice of that in today's politics, is still very much there and has great similarities to that particular movement. Amy Barrett, the last woman to be appointed to the Supreme Court, comes from that kind of background where she has to ask her husband's permission to do things, and she is in total submission to him and whatever it is he wants to do. That's the church she comes from, which smacks, distinctly of that fundamentalist woman in control behavior. The Southern Baptists, in their last Faith and Message in 1998, said that a woman should not speak publicly in church, and if she wanted to learn something or she had a question, she could ask her husband at home. They don't allow a woman to preach, a woman to be a deacon, or sometimes even to teach a Sunday school class where there are male members present, no matter how old they are. So, a lot of them don't even have Sunday school because they don't have men to teach mixed classes, and so it's quite interesting. So I encourage you to read that chapter when you get the opportunity, and I think you'll find it very illuminating as to the importance of what it talks about. We just have so many chapters that we can't get to in this book, but I would love for you to be exposed to those ideas and those teachings as you move forward. Today, I want to talk to you about euthanasia or mercy killing. Basically, our worldview is guided by our ethics. So, the way you look at the world, the lens, if you will, that you look through, very much like the glasses on your face, tell you what you think about the world. And so that's why ethics is really important, and for us to kind of know where we are ethically and what we think and what we believe, because what we believe is actually how we look at the world, and it has a lot to do with that. I had an old teacher, I think I mentioned this to you, who used to say, what you do is really what you believe, and the rest is just a bunch of talk. So basically, you can talk ethics all day, you can talk all kind of things, but if you don't step up to the plate and you don't, whatever it is you're living on a day-to-day basis, that's what your real ethics are. In the last years, probably 1990 and forward, euthanasia has been an issue that we've seen rise time and time again, and come to the forefront of the discussions that we have concerning the right to kill, or mercy killing, as it were. The right to take someone's life or to end someone's life if they're suffering. And we see this, more and more states have actually passed laws that have allowed this to happen. And I think Oregon was the first. Oregon's usually the most liberal state in the union, and will be usually things like marijuana and legalized drugs and things like euthanasia will be at the forefront of what they're about. So we've seen a lot of countries, states, pardon me, that have been considering the euthanasia law, and whether they should allow people the right to die or not. So basically, you're probably going to see more of that in the future as we move forward. More and more states will give the right to end your life. Now, I think, I'm sorry, this morning can't talk. I think that Oregon allows for you to go to a physician there, and that physician to give you the drugs you need to end your own life. It's still kind of a precarious case. We'll talk about Jack Kevorkian shortly, but Kevorkian was basically a doctor who started doing that in the 80s, and when he also went to prison for it. I think he spent the last part of his life in prison because of his helping people to end their life. So euthanasia is quite an interesting dilemma that we have. It's an ethical dilemma. What you feel about it and what you think about it is quite interesting. So let's talk about it a moment. Euthanasia means a good death. Basically, that's what the word means. But sometimes premature babies or seriously disabled newborns that might have a quality of life, that comes into issue. In bygone days, like in ancient Greece or wherever, they would take children that were born that were defective, quote unquote, out to the mountainside and leave them there to die. The problem with that is that we're not able to accurately predict or to judge a person's quality of life, even as an adult. And we get into these situations many times where it's very difficult to do that. When we get to medical treatment, who decides whether to provide or to deny, or what are the reasons for doing one or the other? I've lived through that, walked through that. My mother, who I took care of for 12 years with Alzheimer's, as she got to the end of her lifespan, she kept having UTIs over and over. And for women, the UTI is much more painful, I think, than a man. But she didn't have the capacity to know that it was happening until it got so painful that it was showing on her face, and she couldn't express herself. And it was just torturing her. We took her to the hospital one week, we knocked it down, went back the next week and the next week, it was just this continual thing. And finally, we just decided we had to let her go, that she was suffering. We didn't want to torture her. So we had to make a decision like that. Let me say, while we're talking about that, that it's important for you, even as a young person, that you have a do not resuscitate document, and that you have end of life things that you've expressed. You put someone, you've given someone the medical power of attorney to make those decisions when you're not able to make them, that they can literally make decisions for you. That is of vital importance. So what is the criterion for death? That has changed in recent years. When death occurs, it used to be that a person, if he stopped breathing, was considered to be dead. The reality is, though, that your body can shut completely down almost until you're barely breathing, and yet your brain waves and everything is still working. You can be kept alive artificially on ventilators and on kidney machines and blood pumping machines. They literally can keep you alive almost indefinitely doing that. We've had a lot of these issues come up during the COVID problem that we've had recently with people that go on ventilators. Usually the rule of thumb is that an older person, if they go on a ventilator, it's very difficult, if you can, get them off the ventilator. And so that raises other end of life issues. COVID has been a horrible, horrible thing to face. Basically, they put you on your stomach because you breathe better that way. You're on a ventilator, breathing machine. It must be horrific to endure that, or to think about it, or to think about your loved ones on that. But with almost 600,000 people dead, almost nobody alive doesn't know somebody that's had to go through this problem. But machines can support respiration. They can support blood circulation. Today, death is determined to be whole brain death. When a person has permanently lost all detectable brain function, at that point, the person is dead. There are conditions called a coma or a persistent vegetative state. Those are not considered to be dead. The person may be totally unconscious, or maybe on a machine. We had a case probably the end of the 1980s with a lady named Patricia Shalvo in Florida, in which she was in a persistent vegetative state. She was breathing with a respirator, and they went through all kinds of court battles. I don't think her parents agreed on, one wanted to take her off, one wanted to leave her on, hoping that she would come back to some normalcy. But she'd been that way, I think, a year. Been quite a long time. They finally took her off the ventilator. She did live a couple of days, and but those are hard decisions. Can you imagine making those decisions for your child, or for your for anybody like that? Would be quite difficult to do. It's not an easy thing to make life and death decisions. So there are different kinds of euthanasia. There is passive, that is by stopping or not starting a treatment. That's not prohibited by law. Active euthanasia would be administering a lethal drug cocktail or using other means that cause a person's death. That is against the law in the United States, and that is how Jack Kevorkian ended up going to prison for his dealings. Voluntary, you cause it with the patient's consent. The patient just willingly decides not to take the treatment. My stepfather was in that category. He willingly decided not to go on dialysis, and he was gone within a week and a half. Non-voluntary, causing the death of a patient who's unable to consent, and involuntary, causing the death in violation of the patient's wishes. So those are all the different kinds that we consider when we think about. Physician-assisted suicide is when a doctor helps a patient commit suicide. That's usually indirect. It's usually through a prescription of potential lethal medication. You'll read about Immanuel Kant, whom we have talked about, the great philosopher who condemned suicide as a violation of his categorical imperative. You realize that the Catholic Church, most Protestant churches probably don't agree with suicide. The Catholic Church ties it to a person's salvation, and that if they commit suicide, they can't go to heaven. So basically, that's pretty much their position. Jack Kevorkian, I talked about, was an advocate, a practitioner, physician-assisted suicide. The American Medical Association position on euthanasia opposes physician suicide because it goes against the Hippocratic Oath, which says your job is to help maintain life. And there's a lot of connections between this particular point and what we'll talk about tomorrow with abortion. So think about that as you read through the book. Basically, practice, the different kinds. We kind of confuse it sometimes with active euthanasia. We give pain medication to people that are gravely ill, to a dying patient. There's such things as palliative care. It's terminal, but they do palliative sedation. They give medicine to patients to relieve pain, but also to hasten death as well. The principle of a double effect is acceptable to do something morally permissible for the purpose of achieving some good, even if it might cause harm. So you're doing wrong to do right, and whether it's wrong or not is something you deal with your conscience. So basically, ordinary measures. What do you do with someone that, on the ordinary, that promises reasonable hope of benefit? There are points in your medical journey where the doctor will just look at you and say, well, I've done all I can for you. There's nothing else that I can do. Extraordinary measures can be burdensome and there's no hope of benefit. You will see lots of families that want to deal with this in this way. They want you to keep on doing and doing when basically you're just, running up a bill and there's no hope. You'll see that sometimes with doctors. They start out, Monday saying, well, they're in a coma. They might recover. We'll wait and see. That goes through the week until about Thursday, and that diagnosis suddenly turns rather negative. And by Friday morning, they'll say, well, we need to take them off the breathing machine because there's no hope of recovery. They're brain dead. They probably were brain dead on Monday, but it's just a way also of extracting money from insurance and all that stuff. So it's kind of hard to measure. You have to be the person that takes this into hand, and it's hard to distinguish sometimes the motives of people, even doctors and medical people, as to what they are claiming to do. So basically, when you combine all these together, different types, you have 6 kind of forms. 3 types of voluntary euthanasia: active, passive, withholding measures, passive, without withholding measures. 3 types are non-voluntary. That would be active, passive, without withholding measures, and passive with withholding measures. So basically, those are the different ways that a person can make an exit. We talk about voluntarily choosing to die. It's a really hard choice, but most people, rather than suffer, lots of people would rather not suffer if they could get away with it. I mean, there's certain forms of cancer, for instance, that's very, very painful. Skin cancer, pancreatic cancer, which is almost a sure death, esophageal cancer from acid reflux. All those are very quick forms. There are other forms that take years, like, that take years to take you out. So basically, in weighing whether you want to just voluntarily go on, you weigh the consequences of practices and policies, the possible effects and positive versus negative, quality of life. All those things have to be considered when you're thinking about euthanasia. So basically, euthanasia, Gay Williams says that it's wrong because it's intentionally taking the life of a presumably hopeless person. And there's all kind of arguments for that. You're going to read the different arguments as you move through this, and I'm going to let you do that with these different thoughts and ways of considering the idea of taking someone's life. So what is your position on that? Where do you stand? Is that a part of your ethical understanding? And it's easy for you to say what you do yourself. And as I said, it's really a good idea to have a living will, to have a do not resuscitate document, and that has to ride with you in an ambulance at the hospital. It's not any good in the home in the drawer. So you need to make plans for that. And I'm talking to young people pretty much. But young people are usually the worst offenders because they will not have these things. And when they're needed, somebody has to make that decision. It's really hard on mom and dad to make that for their children. So think about those things when you think of euthanasia. That you will die. We're 100% mortal. That's encouraging, isn't it? We started dying the day we came into the world, but we will die. I hope to live to be 100, but I will die one day, and I hope I make it to my goal. But you want to have these documents in place so that you don't put this burden off on somebody else. Maybe you've known someone that has chosen to just turn loose and let go, and that's quite an emotional thing for a family and for an individual. Well, as you read through this chapter, and I do encourage you to read through the chapter today and get the gist of what they're talking about, the different ways of thinking about it, come up with your own position on it. And you will, as vet techs, you'll certainly be in the role of euthanizing pets, and these are very much like children to most parents. So you understand what that's going to be like. You'll have to deal with the owners who are like parents, and so you'll get a little taste of this in your career, and I know that it'll be painful, something you get used to. And I think someone said the other day about animals wild animals and stuff that you have to euthanize or put down because there's no place for them. There's no money to heal them or cure them. You can't put them back into nature. They'll be killed by predators. So basically, putting them to sleep is an option. And so I know those are hard choices. Okay, tomorrow will be our last lecture. So be sure that you're here, and be sure that you listen, and be sure that you send me a note that you have. Thanks so much, and we'll see you tomorrow.